To access all of the QOF missed income reports, you can go to Reporting and Clinical Reporting. And once this screen opens, you can find the Ardens folder that sits on the tree on the left-hand side of the screen. If I open that, you'll then see a missed income category, which I need to open, and then I can select QOF. So here you'll find all of the Ardens reports for patients who are possibly missing from a QOF register. And to run them, I can select the icon at the top for Select All, and then I can press Run. Alternatively, if I want to run one of them, I can just right-click over the report that I want to run, and then select Run. The reports may take a little while to run, but if you press the refresh button at the top of the screen, you'll often see the results back quite quickly. And once the reports have run, you'll see the number of patients picked up by each of the reports in the count column. So as an example, you can see here we've got a report for query dementia as on repeat dementia meds. So this will show you a number of patients who are on repeat dementia medication but who have not been coded as having dementia, and therefore you're not getting paid for these patients and are missing out on income. Similarly, here we have a report query diabetes as on repeat insulin. And there are some more complex reports. For example, query heart failure is on diuretics and BMP of over 100. And similarly, query IHD as they've had a coronary artery operation or stent. And for any of these reports, you can right-click and then select Show Patients, and that will show you all patients that meet the criteria. From there, you can then open the patient record to determine the appropriate action. And the easiest way to find this is probably by looking at the tab journal or the new journal. And then I can use the search field at the top, just making sure that I click the full filter option just so I'm seeing absolutely everything recorded in the journal. So here, if I search coronary, I can see that the patient has had a stent put in, but the appropriate diagnosis code hasn't been added. Now to add the code, I can go to Auto Consultation, Ardens Contracts, and then select the appropriate template. So here's CHD Secondary Prevention. And here at the top, I've got the Coronary Heart Disease Register, so I can drop that down and then select the appropriate diagnosis code. I've also got all of the other indicators on the template, so if I do have the information, I can add it at that point. And I also have a list of all of the exception codes at the bottom. Now when adding the diagnosis code, just make sure that you do backdate the code to the date of the diagnosis. So here, I'm just going to move the template out of the way. I can see that the stent was coded on the 3rd of December 2016, so I can just add that date at the top of the template. I can click OK to add the code, and then I can save the patient record and move on to the next patient.